Matt LaRocco has arrived. He's brought with him a fellow addiction expert from Louisville. More of an academic than a practitioner, Dr. Quinn Chipley is a self-proclaimed skeptic who is looking forward to meeting the NET patients. He's pretty sure he knows what to expect.
I would expect to see people who were still restless. I would expect to see people who were perhaps even once seated with some sense of seated agitation, some rocking type motions. They probably will have diarrhea because, quite frankly, they will end up having a drug-induced constipation. I'm not so sure that I would be expecting vomiting, but I would expect the people to be saying that they are having to use the toilet frequently. And then they also have a subjective feeling of just being completely ill at ease with themselves in the environment, that they can't settle themselves down.
Brandon is in classes for the morning, but Robert and the others are available to answer questions.
Rocco, nice to meet you again.
Kevin is up first.
Well, I'm interested to know what your experience has been since Monday of getting here and starting with this particular procedure and this device that you're now wearing. And
well, it's definitely made a difference. Ain't no doubt about it. It's cut a lot of the little symptoms like runny eyes, the nose, and the diarrhea. I've had none of that.
What's it feel like?
That's just like a little vibration.
Okay.
That's it.
okay.
So what's the last few days been like, I guess, is the...
I'm not sleeping as good, but dude, I'm more clear. Clarity's a lot better, and it's going a lot better than what it was when I was using. I believe in this thing, man.
How's your appetite been comparative to...
I've eat like a horse in the past 2 days, man. Yeah, I eat a lot, dude.
I hated the fact that I had to do Suboxone because I was replacing one drug with another drug. I mean, I felt high off Suboxone, so I was like, this isn't solving anything because I'm gonna be addicted to something else. Whereas when I came here and tried this, you know, my cravings have been almost completely zero, and I've had no withdrawal symptoms, basically at all. I mean, what I've seen the past 3 days has been things that I had never even thought were possible or plausible. I mean, it's still new to me, so I'm learning every day. So, I mean, it's crazy. I didn't think it was gonna be that way.
Fair enough. I mean, my interest is peaked. This looks really good, but to really be able to go, yeah, it's sign my name behind that, I think you've got to go do the due diligence all the way through, yeah.
The thing that surprised me most in the moment is that we have people who are only 2 to 3 days into their acute withdrawal from their substance of choice, and they are not reporting feelings of immense dysphoria. They're not having diarrhea, they are not having vomiting, and they are having normal appetites at, much earlier than normally I would ever expect to see. So I find that to be really astounding.
And then the other thing I thought was interesting is having been around people who are at day 3 or day 4 of opioid detox in an abstinence setting, or even working with people who've been dosed with buprenorphine or methadone. I would say that the people that I saw today look better and are clearer than the people in those other situations. I'm fairly surprised.
This visit has stirred up many questions for Matt and Quinn. Questions that might be able to be answered by Joe Winston, the person currently in charge of NET.
So your question would be, is the treatment effect durable? Does it last? And so we have 2 metrics. One of them is a drug test. We didn't use self-report. There are lots of reasons a person might change their report. We actually took urine or oral swabs, and we found that, again, 90% of the people that we managed to find tested clean. Do you know the most dramatic thing for me is you will see people on day 2 throwing a football. I don't know, you ever watch someone come off cold turkey throwing a football on day 2?
You guys have been at this for 30 years. Overall, the NET device has been worked with, what, 30, 40 years, something like that? So why do you think it hasn't been picked up? What is it that is keeping something that you obviously believe works and your figures suggest works? Why do you think it's not being picked up?
I think that the reason has changed over time. I think initially there is a natural resistance in the Western world to medication based on electrical stimulation. We just don't understand how that works, and so we tend to reject it. We're beginning to understand how it works. So why is it rejected today? I think today it's rejected for a very different reason. There is substantial business in the treatment of opiate addiction today. This is a very large industry. And if people that you treat are in treatment for less than 2 weeks and they don't require subsequent treatment, it eviscerates the amount of money that is available to treat opiate addiction. This is a very bad business.